What happened to his hair? It's gone. I cut it. Just a note. A clipper 3 is different than a trimmer 3. I bought a new pair of trimmers, put on a 3, told my wife to cut my hair, and here we are. It's more like a 0. I mean, it's like a 1 maybe, but it's pretty dramatic. But it's nice. We're hitting triple digits here in Texas, so I can't really complain. Still a little bit dangerous to get a haircut at a barber shop. We're hitting 1,200 cases a day, so I'm good with a buzz cut. I'm not too picky. But shoulder update. Saw the surgeon yesterday. Today is 7 weeks post-surgery. Got really good range of motion. You can see my scar. That's the largest of the scars right there. 7 weeks today. Surgeon said that everything looks good. I've got pretty good range of motion. I still can't lift much weight. Nothing more than a glass, maybe a plate. I'm not really cleared to do anything beyond that. I'm still doing really minimal lifting with my right arm. One amazing update is that I don't have to sleep in a sling anymore. I was sick of sleeping in that damn sling. It was just very uncomfortable. You have the whole strap around your neck. It was a total pain in the ass. So that was a huge update. That my dog's drinking water. That was a huge update. He said everything looks good. For now at PT, I'm just going to keep doing range of motion stuff, super minimal weightlifting. And I'm going to see him again in 6 weeks, and after that, then I can start lifting slightly more weight. I relayed that information to the physical therapist. She was psyched to hear it. On this side of things, I had therapy just 2 hours ago. On this side of things, what she's seeing in therapy looks really good. She said I'm in the top percentile for my rate of recovery. And so it's looking positive. I had a couple questions that I asked the surgeon. I was like, can I go swimming? He said no, it puts more pressure than you would think on your shoulder, so we don't want to do that for a couple weeks. All of the little sutures that were sticking out a week ago, I had them up here and in the back, those have fallen out, which is good. I was gonna be a dumbass and like pull those things, but you shouldn't. They dissolve just like the surgeon told me they would. And just been doing exercises. I'm icing. The doctor said I'm going to be icing for 6 months. Most likely. The more I can ice, the better. And yeah, he just said you need to continue to take it easy. I asked if I could go jogging. He recommended not to. Anything that I can't do controlled, like jogging, if I were to fall or something like that, that could cause problems. So I'm more than happy to just follow his direction. I think it's still mostly limited. I'm able to drive, which is awesome. At 4 weeks, generally you can drive. But I'm making progress, but it's definitely slow going. I sort of told him, I'm sore. I'll wake up randomly sore, and I'm not really sure if that's like hangover pain from PT or if it's how I'm sleeping on it. He said if you sleep on the right side and it's bugging you, then you know to sort of take it easy and not sleep so much on the right side, that kind of thing. But he said, we drilled into your bone, we cut off your bicep, and it's stuck into that hole that they drilled. So he said there's going to be some pain for throughout this process, just because that's the nature of the surgery. It's not a shoulder replacement, but it's still, there's still a pretty prolonged recovery time. they say up to 2 years for like 100% recovery. But I feel pretty good that when I went into the surgeon's office, I was able to sort of do all these movements. He checked out all these incisions, and he said that everything looks really good. So I felt really good about that. And I said, my PT is really positive about the progress I'm making, and so all is well. So we just keep trucking at this point. PT's not going to change too drastically in the next couple of weeks. She might progress me along more quickly because I am doing better than 75% of people, because I've had an arthroscopy in the past, and I was a person who got a frozen shoulder, so I came into this kind of having a little bit of an idea of what recovery would be like. I think that helped me a lot. I'm also taking protein powder, which is not something I mentioned in previous videos, but I was just talking to my friend, and a couple of days before the surgery, I was walking with my wife, and I kind of mentioned, I was like, it's probably a good idea for me to like take some kind of protein supplement. It couldn't hurt as far as recovery, because that's generally what they do, is they help to build those tissues back up and give you extra protein to work with. And I do think that some portion of my recovery is attributable to me taking protein shakes. I haven't been as religious about it in the last couple of weeks, but I think I've had one the last couple of nights, and I think I'm going to continue to do so, because I am noticing a pretty big difference between this recovery and the last surgery I had. So if anybody is looking at post-surgery recovery, or even pre-surgery, if you want to just take it preemptively the week before the surgery, put on some healthy weight and just maybe take in a little bit more protein, I would recommend it. I did kind of Google it, and there are some studies out there that show the benefits of additional protein, especially after surgery during recovery. So if you're looking on going into a surgery, no matter if it's knee or shoulder or whatever, I would recommend buying some whey protein or some kind of protein shake and supplementing with that. I've noticed, I'd have to say, some kind of positive benefit from doing that. So it couldn't hurt. I mean, there's nothing that could go wrong from doing a scoop of protein. I mean, it's going to have no negative effect on you, as far as I can tell. So it's worth trying. Anyways, this is 7 weeks, like I said, to the day. I'll keep doing updates every week or two as I keep up. I'll keep doing movie reviews too. I haven't watched that many movies lately, but there's an Uncut Gems review. That's the last one that I did. I'll put that up probably this afternoon. So that'll probably be on YouTube if you want to check it out. But for now, it's just keep recovering. My next appointment with the surgeon is in 6 weeks, so mid-August. And I don't know. This is what we're doing. This is recovery. It's definitely a pain in the ass, and it's definitely painful at times, but it is really nice to be able to move your arm, because for weeks I just, I wasn't able to do this. I was very skittish, but yeah, progress is progress. So yeah, if you guys are going through a similar surgery, check out my other videos, and hopefully it helps somebody out. But for now, signing off.